The most important thing with any victim is that the airway is the priority. The wheelchair can often be a distraction from the main focus, which must remain the removal of the obstruction fast.
What's that? Neil, look at me. Can you cough?
In the first instance, encourage the casualty to cough. If they are unable to cough,
Can you cough?
or it is clearly not working,
Can someone help me, please?
shout for help and apply the brakes. Lean the casualty forward and administer a maximum of 5 back slaps between their shoulder blades. If this doesn't work, place your arms around the casualty, grasp your hands together forming a fist and pull inwards and upwards sharply beneath the rib cage. Do this for a maximum of 5 attempts. Remember that if at any stage you think you have dislodged the obstruction, check the casualty's mouth and remove it if possible.
Paul, can you get an ambulance, please? You've got a full obstruction here.
Yeah, no problem. Okay, no worries. Hello, yes, ambulance, please. Yeah, hi, we've got a guy who's choking in his wheelchair and we can't remove the obstruction. We've tried everything we possibly can, but we're very, very concerned now. I wonder if you could come out to us as soon as possible, please.
If you have somebody with you, send them to call an ambulance as soon as possible, while you continue to attempt to remove the obstruction. If you are on your own, repeat the cycle of 5 back slaps, followed by 5 abdominal thrusts, 3 times. If you have not been successful, leave the casualty, call the ambulance, return as quickly as possible, and continue with the cycle of 5 back slaps and 5 abdominal thrusts. The following techniques can be used in situations where you cannot do conventional abdominal thrusts. The first technique is modified abdominal thrusts from the front. Secure the wheelchair by backing it against a wall or steady furniture and apply the brakes. Deliver the modified abdominal thrust using the technique shown here, alternating with back slaps. An example of when you might consider this technique could be when your arms cannot reach around the casualty to deliver abdominal thrusts in the conventional manner. The next technique is chest thrusts. These are administered by standing behind the casualty and pulling sharply inwards in the center of their chest. Once again, alternate these with back slaps. If you are unsuccessful in removing the obstruction, you must consider getting the casualty out of the chair and onto the floor. The technique you employ will depend on how many people you have to assist you.
How you getting on, Steve?
Yeah, it's not coming out, mate.
No? Do I have to get him out of the chair, do you think?
Yeah.
All right,
let's
let's get him over here.
Okay,
Let's
brakes
get him
off.
out, yeah?
Remember that you must try and employ correct manual handling techniques
That should do
and
it.
protect yourself from injury.
2, 3, lift.
Once on the floor, check to see if they
All
are
right,
breathing.
gently, gently.
If they are breathing normally, you should continue to try and remove the obstruction. In this example, by using modified abdominal thrusts.
I don't think there's any signs of breathing now, mate. I think we're really going to have to get on with some basic life support now.
Okay.
Yeah, no, I don't think there's anything there.
If they are not breathing normally, stop any further attempts at removing the obstruction and start basic life support.
If you do a couple of minutes, Steve, I'll take over from you. Yeah?
Yeah.
Remember that the chest thrusts performed here in basic life support may well help to remove the obstruction. With the rescue breaths, now that the casualty is unconscious and their muscles relaxed, you should be able to force air past the obstruction into their lungs. It is highly unlikely that your rescue breaths will force the obstruction further down. Every situation will be different, but if you let the chair become your focus, rather than the casualty's rapidly developing hypoxia, that is, lack of oxygen to the brain, then you risk having a dead casualty in the chair because your mind was elsewhere.
Someone help me, please.
You need to act quickly and apply the techniques shown with common sense to ensure a good outcome. In all cases, do not delay calling the emergency services.